The CBO says that your Medicare plan could more than double seniors' out-of-pocket costs. Is it realistic to assume that most seniors would be able to afford those cost increases?
A couple of things on that analysis. Number one, it fails to take into consideration the extra $7,800 we're talking about adding to low-income seniors' benefits. So what we're saying is protect those who are low-income by supplementing their benefits and covering their out-of-pocket costs. We're also saying as people get sicker, increase their payments to stabilize their premiums, and as people get wealthier, don't subsidize them as much. So it's really inaccurate to suggest that that's going to happen to everybody. But the other thing I would say is it's comparing Medicare to a fiscal fantasy, which is the current system is unsustainable and it's growing at rates that are unsustainable that will crash the system. And so the question is, what are the kinds of reforms we're putting in place to get at the root cause of health inflation, to make our healthcare dollars stretch farther, to inject competition into the system so we can stretch our dollar farther, and then subsidize people more who need it more and not those who need it less. And so it's really kind of an incomplete comparison to suggest that that's happening to everybody. Yes, wealthier people are going to pay more in the future, but more importantly, there's only so much money to go around. It's finite. And what we believe we should do is save Medicare so it's something that the next generation can count on, and subsidize people who need it the most and not as much people who need it the least.
Hi there. I'm 48 years old, so I'm in the age group that would be impacted to the changes to the Medicare program under the so-called Ryan plan. I'm also the caretaker of an elderly parent. It's common in my age group. How can I be certain that Medicare will be affordable for me when it comes time for me to retire, especially considering I've been paying in for 30 years?
Right. I'm the Ryan guy. So I guess I'll answer the question. A few facts that are not in dispute. Fact number one, we have 10,000 baby boomers retiring every day and fewer workers coming in to pay taxes to pay for the program. Fact number two, healthcare costs, they're skyrocketing at about 4 times the rate of inflation, which is threatening Medicare's current ability to provide affordable, accessible care. Fact number three, all the independent experts agree, Medicare's going bankrupt. Medicare, along with Social Security, I would argue, are the most important federal programs we have. And so what we want to do is save and strengthen the program. Here's what we say. Number one, if you have retired already, or if you're 55 and above and you're about to retire, government made a promise to you. We should keep that promise. So we say, don't change the program for anybody above the age of 55. But in order to be able to do that, in order to cash flow that promise, prevent that bankruptcy from hitting my mom who's on Medicare, and my mom and I took care of my grandmother when she was Alzheimer's on Medicare. This is very important to me personally as well. You've got to fix it for the next generation if you want to keep it for the current generation. And the way in which we propose to fix it for 54 and below are to have a system that works like the one we have in Congress, like the one that President Clinton's Bipartisan Commission to Save Medicare proposed in the late 1990s. It's an idea that's had bipartisan support in the past. It's called premium support. It works just like Medicare Advantage today, Medicare prescription drugs, Medicare supplemental. You get a list of plans that Medicare pre-approves that are guaranteed coverage options that you select from. These plans compete against each other for your business, and then Medicare subsidizes that plan based on who you are. If you're a wealthy person, we don't think taxpayers should subsidize their health care as much as everybody else. If you're a lower income person, or if you're a person who keeps getting sicker, we think we should have increased subsidies. And so what we say is, starting for the 54 and below crowd when they turn 65, is take what we spend per person on Medicare, apply it to these people, adjust it, like I said, less for the wealthy, more for the poor and the sick, so that they can have plans to choose from and use choice and competition. Here's the alternative. The president passed a law. It's in law. Obamacare. I know people don't like being called Obamacare. The current health care law raids $500 billion from Medicare to spend on this new health care law. And then it puts a board of 15 unelected, unaccountable bureaucrats in charge of cutting Medicare for current seniors through price controls, which will lead to providers dropping care, which will lead to rationing, which will hurt the actual program for current seniors. We repeal the rationing board. We repeal the raid of Medicare. We think Medicare funds should go to Medicare, not other programs. How many times have you heard this on Social Security? And then we save it for the next generation so that we can cash flow the promise and keep it for the current generation. So when you turn 65, you'll have a program that will be there for you. At the age you are, 48, I'm not that much younger than you, it's not going to be there for us if we don't do anything to save it. It is going bankrupt. The sooner we act on this, the better off we are, and the more gradual the necessary reforms are. It will be British austerity. It will be painful benefit cuts to current seniors, tax increases on everybody like young people that slows down our economy if we keep kicking the can down the road. And it is the political careerism around here that has put us in the mess we are in, and you need leaders to step up and stop doing this. We put a plan out there. I don't expect everybody to like the plan, but at least we put a plan out there, and I would love to see our partners on the other side of the aisle put their alternative plans on there so we can get to the business of actually solving this problem.
We need to kick this can over to Rebecca.
I think it's a sign of the anxiety of the times. It's also the sign of the misinformation that's been perpetrated out there.
But why do you say misinformation?
Well, there are TV, radio, and phone calls that are running trying to scare seniors. There are the Democratic National Committee is running phone calls to seniors in my district, TV ads, saying we're hurting current seniors, when in fact that's not the case.
Isn't that
so
though
there's a
par
lot of
for the course?
and
I mean, didn't you lot do it the last time?
Both parties do this to each other, and my whole point about that is that's why we had this political paralysis.
On the day we join him, the gym at Franklin High School fills up well before the congressman arrives.
Hey, everybody.
Ryan's presentation is earnest and, it must be said, wonky.
This pie chart shows you our federal government, basically its budget for last year.
The most controversial aspect of Paul Ryan's budget plan would transform Medicare. He knows that could be political poison with seniors, and so he makes sure to remind those in the crowd the changes won't impact them.
How many of you are 55 years of age or older? This budget does not affect your Medicare benefits.
But for many, that leaves more questions than answers, especially since budget watchdogs estimate the Medicare revamp would cost people who are now under 55 thousands of dollars out of pocket each year once their benefits kick in. And that has some here in Franklin very concerned.
It's going to be a real burden for them, especially with the economy coming up. And I think about all the 54-year-olds who have been unemployed. Where are they going to come up with this money in 10 years to last their whole lifetime?
Ryan argues delay is not an option.
Put these reforms in now, they don't take effect for 10 years to give people time to prepare. If we keep kicking the can down the road, and if we keep going trillions of dollars deeper in the hole, then the reforms are going to be sudden, urgent, and severe and immediate, and people won't have, they're going to catch them by surprise.
Then the session ends,
Hey, I appreciate you coming out.
and Congressman Ryan is off.
Thanks.
One of the main things you do, as you just suggested, has to do with Medicare. You essentially end Medicare as we know it, and you replace it with a system of subsidies to private insurers. Why is that better for seniors?
Yeah, I wouldn't say it ends Medicare as we know it. Private insurers are already in Medicare. Medicare Advantage is nothing different than what I'm talking about, which is about 20% of Medicare beneficiaries get comprehensive private plans.
That's one part of it.
Medigap is private plans. The Part D benefit is private plans. So what we're doing is we're taking a look at the lessons that have worked. The prescription drug benefit, for example, that came in 40% below cost projections. We're copying that kind of a model. So specifically what we're saying is if you're 55 and above, no changes whatsoever in Medicare. But if you're like me, if you're 54 and below, Medicare is going insolvent by the end of the decade. It's going bankrupt, and it's leading our country toward bankruptcy. So future seniors, 54 and below, will get a list of Medicare-approved plans, kind of like how it works today, but for all of Medicare. And it's a system that works identical to the one members of Congress and federal employees have. They choose among the Medicare plans for their business, and that choice and competition actually helps bring down costs and expand availability. And the actuaries at Medicare tell us that doing it this way brings Medicare into solvency and pays off the debt.
So instead of making payments directly to hospitals and doctors,
That's right,
the payments
exactly.
would go to private
That's
insurance plans, in effect moving toward privatization of Medicare.
No, I wouldn't say that. If that's the definition of privatization, then Medicare is already privatized. Because already Medicare works through private companies to deliver services to Medicare beneficiaries. So if you're calling that privatization, then it's already privatized. If you're suggesting that the federal employee health benefit system is a privatized system, we're just basically copying the federal employee system. The key is this.
That's a plan that doesn't have a cap on payments.
Sure it
yours
does. Yeah,
would.
no. The federal employee benefit system only pays so much, and then the federal employee pays the rest. They pay about 75% of our costs, and then federal employees pay about 25% of their costs. It works like that. See, the key is this, Judy. We want to have choice and competition, and having these insurers compete against each other for the Medicare beneficiaries' business That gets savings. That roots out the billions of waste that we have in Medicare. The current Medicare structure is a structure that's going bankrupt. It's a source of health inflation. It involves billions of dollars of waste in Medicare, and we can go after that kind of waste, and we can stretch our healthcare dollar farther by doing these kinds of Medicare reforms, which basically says that younger people, Medicare will work like the plan that I have as a congressman and other federal employees have. That's not a privatized system.
A few sentences later, CBO also said that the status quo of Medicare is unsustainable.
Maybe, but it's going to shift a huge burden onto the elderly.
But what the CBO also forgot to add is that we're giving an additional $7,800 for low-income seniors on top of that. And I would argue, and CBO concurs with this, comparing any Medicare reform plan with the Medicare status quo is a fiscal fantasy. The Medicare status quo is not going to be able to occur because it's unsustainable.
And Ryan dismisses any talk that tackling this thorny issue will cost Republicans at the polls.
And now people are getting worried, people in your party. Perhaps they might think it might even cost them the election.
Sure, and I hear this all the time from the political people, from the pundits and the pollsters, that this could hurt us politically. I don't care about that. What I care about is fixing this country and getting this debt situation under control. Look, literally, Christian, if all we fear about is our political careers, then we have no business having these jobs. If you want to get good at these jobs, you got to be willing to lose the job.
And very quickly, to the criticism from Democrats who say, yes, you're addressing the deficit, but you're doing it by letting the wealthiest Americans keep their tax cuts, but you're balancing the budget on the backs of the poor and the most vulnerable.
We're getting rid of corporate welfare or means testing programs so we don't subsidize wealthy people as much. And we are reforming the tax code to get growth. You got to have spending cuts, spending reforms, and economic growth and job creation. That's the key, and that's what we're achieving. To Democrats, I'd say, please bring us a budget and let's see what you have to offer. They haven't done that yet.
And finally, you are asking for trillions of dollars in cuts. Today, President Obama, Speaker Boehner met just to talk about tens of billions of cuts, disagreement over cuts in the current year budget. Much less than what you're talking about.
That's for sure.
Is that a fight that's worth shutting the government down?
Well, look, we don't want to shut the government down. We will have passed 3 bills by the end of this week to prevent the government from shutting down. But we do have to get a handle on spending. So we're trying to get some spending reductions. We're talking about shaving 2 to 4% off this year's deficit. The spending cuts we are talking about would bring our deficit from $1.6 trillion to $1.54 trillion. Now, come on. These are not deep spending cuts. And so the question I have is, why hasn't the Senate passed a bill to prevent a government shutdown? The House has 3 times now.
Representative Paul Ryan, thank you very much for talking with us.
Thank you, Judy.
Late today, the White House issued a statement saying the president agrees with Representative Ryan's ultimate goal, but he strongly disagrees with his approach. Tomorrow night, we will talk with a ranking Democrat on the House Budget Committee. He's Representative Chris Van Hollen of Maryland.
Hey, folks. Nice to see you. Thank you very much.
Some boos, but mostly cheers. The crowd is largely supportive.
And I'd like to thank you for being a bold person and standing up and saying, listen, we can't continue this way.
Still, this man is angry that Ryan's plan refuses to consider raising taxes on the wealthiest Americans.
Borrow the money from the rich. Fix the problem.
Look, I think a lot of people think this is sort of like the magic fairy dust of budgets, that we can just make a small amount of people pay some more taxes, it'll fix all of our problems. But let's keep our eye on the ball. The eye on the ball is spending. And the sooner we get this thing under control, the better off everybody's going to be.
How do you feel about being made the boogeyman, this whole budget business?
You know, I don't really think about it. I sleep well at night.
At the end of the day, Congressman Ryan and I sit down to talk about the bottom line.
People who've been studying your numbers very carefully and have been saying that the numbers don't add up.
Well, the Congressional Budget Office says they do.
Well, it also says that 2/3 of the savings that you want to make and the spending cuts come at the expense of programs designed for the poor, for the disadvantaged, and this is reverse Robin Hoodism, if you like.
Sure.
Take from the poor, give back to the rich again.
I would disagree with that. First of all, spending increases in this budget. Spending on the safety net increases, but it increases at a more sustainable rate. Here's the problem, Christian. The safety net we have right now is going bankrupt. It's tearing apart at the seams.
What you're proposing seems like it's going to put a lot of the burden on the seniors. They're worried that they're not going to be able to afford the cost of health insurance.
So we're saying give the most vulnerable people more money to cover their expenses and don't give wealthy people as much money to cover their expenses because they're wealthy and they should be able to afford more. But we're also saying is you've got to get at the root cause of health inflation. Even President Obama is saying, slow the growth rate of Medicare.
For now, the president and the congressman seem far apart. And as we crisscross his Wisconsin district, I asked Paul Ryan if some grand budget bargain could be in the offing.
Do you think that these massive issues that you're dealing with, the budget, let's say, can be done only by one party?
No, I don't. I think
you
it's gonna
have to negotiate,
yeah.
you have to work together.
Yeah, I think so.
Is that atmosphere available in the...
Not right now.
It's not,
Look,
is it?
we're probably not going to get some grand slam agreement that fixes all of these problems. My now hope is to get a single or a double, you know, to get something done that gets us on the right path.
Congressman Ryan says that he expects Republicans and Democrats to agree on some fiscal controls to lock in spending levels, but he says a big picture deal on the debt crisis probably won't happen before the 2012 election.
Going forward, here's the deal. I think Paul, for example, head of the Budget Committee, has looked at the budget and has made a serious proposal. I've read it. I can tell you what's in it. And there's some ideas in there that I would agree with, but there's some ideas that we should have a healthy debate about because I don't agree with. The major driver of our long-term liabilities, everybody here knows, is Medicare and Medicaid and our health care spending. Nothing comes close. Social Security we could probably fix the same way Tip O'Neill and Ronald Reagan sat down together and they could figure something out. That is manageable. Medicare and Medicaid, massive problem down the road. That's where, that's going to be what our children have to worry about. Now, Paul's approach, and I want to be careful not simplifying this because I know you've got a lot of detail in your plan. But if I understand it correctly, would say we're going to provide vouchers of some sort for current Medicare recipients at the current level. 55. Well, no, I understand. I mean, there's a grandfathering in, but just for future beneficiaries, right? That's why I said I didn't want to. I want to make sure that I'm not being unfair to your proposal, but I just want to point out that I've read it, and the basic idea would be that at some point we hold Medicare cost per recipient constant as a way of making sure that that doesn't go way out of whack. And I'm sure there's some details that
we grow it at a blend of inflation and health inflation. Right. The point of our plan is, because Medicare, as you know, is a $38 trillion unfunded liability.
Right.
It has to be reformed for younger generations because it won't exist because it's going bankrupt. And the premise of our idea is, look, why not give people the same kind of health care plan we here have in Congress? That's the kind of reform we're proposing for Medicare.
Right. So, look, as I said before, this is an entirely legitimate proposal. The problem is twofold. One is that depending on how it's structured, if recipients are suddenly getting a plan that has their reimbursement rates going like this, but healthcare costs are still going up like that, then over time, the way we're saving money is essentially by capping what they're getting relative to their costs.
Washington has not been honest with you about Medicare. Medicare is a critical program which helps seniors achieve health security. But the truth is, it's headed for a painful collapse. We can save Medicare, but we have to reform it so that it delivers the high quality we expect at a price we can afford. Let's take a look at what's going on now, why it's happening, and how we can save and strengthen this program. The average American household spends nearly 50 times more on health care today than it spent in 1960. This translates into health care costs of more than $25,000 per U.S. family every year. As a result, healthcare spending has gone from consuming just 5% of our economy to nearly 1/5 of our entire economy today. While a lot needs fixing in healthcare, independent experts agree Medicare is a top driver of these unsustainable costs. If we do nothing, Medicare spending will nearly double over the next decade, exhausting its remaining funds. Here's why. More than 75% of Medicare recipients, which is 35 million people, receive what is called the fee-for-service insurance plan. Here's how it works. A Medicare patient goes to the doctor and receives health care services. The doctor sends the bill for these services to Medicare, and Medicare reimburses the doctor with your tax dollars and borrowed money, no questions asked. The system increases costs and decreases quality for two reasons. First, as you can see, the patient is very disconnected from the cost. We all pay for Medicare through taxes, or if you're a Medicare patient, through premiums. But the true cost is hidden from the Medicare patient because someone else pays the actual bill. When we pay directly for something and we know how much it costs, we have a strong incentive to demand the best value. In healthcare, we don't. The second reason costs are going up and quality is going down is that fee-for-service Medicare insurance has no competition. So it reimburses all doctors and hospitals the same, even if the quality of their care they provide is poor and the cost of their care is high, meaning there is little financial incentive for doctors and hospitals to deliver the best care at the lowest price. Many experts agree that this leads to rising costs, but the disagreement is over what to do about it. The president's plan is to let a panel of 15 unelected, unaccountable bureaucrats decide how much or how little Medicare will pay doctors and which services Medicare will or will not pay doctors to provide for their patients. These are price controls, and we've tried them before. They encourage more consumption and they force doctors to charge their non-Medicare patients more. That pushes costs up, not down. If we keep going down this path, many doctors will stop seeing Medicare patients altogether, restricting access to health care for seniors and leading to waiting lists and denied care. There is another better approach. The House-passed budget, the path to prosperity, saves Medicare for current seniors and strengthens it for future generations. Those in and near retirement should not be forced to reorganize their lives because of government's mistakes. That's why our budget ensures no changes for those 55 years old or older. But for current taxpayers and future generations, we need real reform. Rather than putting the government in charge, our plan provides financial support to help future Medicare patients pay for the insurance plan that works best for them and their families. Patients will have the freedom of choice from a list of guaranteed coverage options, the same kind of system members of Congress enjoy today. And insurance providers competing for patients' business will look to lower costs and increase quality for their services, the way it always works when the consumer is in charge. Our plan also ensures lower income seniors and those with greater healthcare risks will receive greater support, while wealthy seniors receive less. The urgent need to reform Medicare and the president's misguided approach have left us with a serious question to ask. Who should be making healthcare decisions for you and your family? A government monopoly and a panel of bureaucrats in Washington, D.C., or you?
The other thing is, I just think his Medicare proposal is on the merits wrong. That is, there is no reason to believe that if you cut a check to all the people on Medicare, that all of a sudden they'll have market power and they'll drive down Medicare costs and they'll be better off. What in all probability will happen, particularly if they dismantle some of these other cost controls, is that medical costs will continue to go up and older people will use less, get sicker, and die quicker, or they will be poorer because they'll have to spend so much of their money on health care. In other words, the problem is rising medical costs. Medicare is a part of a whole health care system that has a toxic rate of inflation and a spending base today that's not sustainable. It's also one of the major reasons people don't get pay raises. Employers that try to provide health care to their people find in a down economy that it takes whatever increased revenues they allocate to labor just to pay for the health care premiums, and they got nothing left to give pay raises. So I don't I applaud Congressman Ryan for making a suggestion, but I think on the merits it doesn't work. And that's really what I hope the lesson that we'll draw from the New York election, not that we can't talk about Medicare and we have to tippy-toe around, because we have got to have a system that brings health costs in line with our competitors.
But there is a difference of opinion here, and this is where he did show us some acknowledgement of the facts. And the acknowledgement was healthcare costs are going too fast. That's what's bankrupting Medicare and Medicaid, and we got to deal with this. There's two ways of dealing with this, Charlie. The president just said he wants his IPAB, this unelected bureaucracy with no oversight or control from Congress, to just indiscriminately cut Medicare reimbursements, Medicaid, meaning price controls from government. That doesn't work. We've fought inflation in the past, and price controls don't fight inflation successfully. They just make resources more scarce. They just deny people care. We believe competition is the better way to go. We believe competition and choice is the best way to go after price increases and health inflation. And the reason we say this is the evidence is pretty clear. The prescription drug benefit, and the design of which is what we're trying to replicate here, that benefit came in 40% below cost projections because it harnessed the power of choice and competition. Seniors get to choose among a list of Medicare pre-approved plans, and those plans compete against each other for the senior's business, and that act of competition has resulted in lower premiums and less cost to the taxpayer and better quality for the senior citizen.
With respect, he has done more than just simply suggest a new commission. I mean, he really has, in a sense, given you a philosophical base, you know, and made some criticism of your proposals and suggested some direction that he wants to go in. A lot of other people are demanding
there's no specifics.
more facts.
There's no. All I know is he wants to have IPAD do more, which is more rationing of Medicare. All I know is he wants the government to take decisions away from Congress on how Medicare runs and give it to the Department of Health and Human Services and let them twist the screws and ration care. That's the only idea I got out of him today. Nobody is arguing against capping spending around here. The only difference is this law empowers the IPAB with the unilateral power to decide how to live underneath that cap. And where we have an issue with, you mentioned affordable care organizations, there isn't a Wisconsin provider that's willing to sign up for this.
Accountable.
The ACOs.
Right.
What our concern is if we invest all of the power and the funding decisions with a board of 15 people whose decisions go into law don't even go through Congress, is that the best way to save this entitlement and to restrain spending? We believe there's a better way, and we believe giving seniors the choice, like we did with Part D, is a better way, because what it does at the end of the day is it shows providers, if you want to succeed, if you want to have business, you got to outcompete other providers for that beneficiary's business. So the nucleus of the program we're trying to talk about is the patient, the beneficiary, not the IPAB. And there's the big difference at the end of the day. We really believe, because of evidence and reality, giving seniors more choices, where providers, doctors, hospitals, insurance companies compete against each other for that beneficiary's business, that works. More importantly, you talk about what this would do to future seniors. We think we should give more money to low-income people, more money to sick people than to wealthy people in the future of Medicare. And if we do it in a way like we're proposing, you don't have to do all of this to the current population. You don't have to have IPAB start their indiscriminate price controlling in 2013. You don't have to do any of that. You don't have to affect benefits for people above 55. And we can cash flow and borrow the money to cash flow that generation if we reform our generation, those of us under 54. And in the way in which we think we ought to do that, more money for the poor, more money for the sick and the middle income, and less money for the wealthy. It's an idea that used to have bipartisan support. It's an idea that came out of the Clinton 1999 Bipartisan Commission to Save Medicare. It is a very good and legitimate debate about growth rates and how you grow a payment and what should it be, GDP or GDP minus this or that. That's a very fair debate. But at the end of the day, where I think we have a disagreement is we don't think we should invest all of the power and money decisions into the hands of 15 people who aren't even elected versus giving seniors the ultimate decision and controlling how their health care is to be delivered. Because if we just simply give 15 people the ability to unilaterally underpay providers, and we see where this is headed, what's going to end up happening is providers are just going to drop Medicare. I don't know what you call that, but I don't know. It's rationing under a different word. Because if you say to a provider, we're not going to pay you anything close to what it costs to provide the service, they're not going to provide that service.
Which is what we need here. What's your alternative plan? What's your alternative plan?
The alternative plan is the iPad.
The alternative plan. Thank you. Exactly. The alternative plan is not cost shifting, actually like taking the cost burden and taking it from government or employers onto individuals, retirees. Good luck out there shopping for insurance with an inadequate voucher. It's cost savings, and the only way you do that is exactly as Mr. Ryan said, which is cost effectiveness through the Independent Payment Advisory Board, which has to get under the hood, look at how we're wasting money, which we do. In the private system, it's even worse than in Medicare, but we can agree on that, Representative. There's a lot of waste. And the only way you get...
It's not worse in the private sector, though.
So let me give you...
It is. Private sector health care costs grow more quickly than public. I think Representative Ryan would corroborate that.
But the amount of fraud is much higher in Medicare.
No, I'm sorry. It's just that is a prejudice. But Becky, I can send you the numbers. Medicare has grown consistently more slowly than private, and Medicaid is even more.
60 Minutes did a huge report on the amount of fraud in Medicare and the amount that gets ripped off. If private companies actually spend a lot of time trying to cut that out.
If I send you some graphs later, maybe you can put them up.
Send them to me.
Jared does a good job. You do a good job of representing your side's point of view. And here's what the iPad is, the Independent Payment Advisory Board. It's 15 people the president appoints to be in charge of Medicare financing, price controlling, designing new payment structures for Medicare. The lesson, I think, from the iPad was that the 1997 law, which put price controls on providers, didn't really work. Providers were leaving Medicare, dropping benefits, so Congress passed 2 subsequent pieces of legislation trying to put the money back into the Medicare system because providers are leaving the system. So here's the lesson that we learned out of that. Price controls don't work on anything, but at least which is Medicare. What I think Jared's side of view is that, no, price controls, you have to get outside of the politicians. Price controls don't work because politicians lose their will. Yeah. So this iPad circumvents Congress, puts the recommendations in place without congressional consent. And if Congress doesn't like it, they have to replace the kinds of price controls somewhere else within the Medicare system of an equal amount.
I would never refer...
What I'm saying, if you don't mind, I try not to...
Go ahead.
What I'm saying is, the difference here is, we don't think Medicare or any healthcare system should be organized by a handful of unaccountable and unelected bureaucrats imposing price controls. We believe in patient-centered healthcare. We believe in a consumer-directed system. And we believe that this system should be one where we empower seniors to be good consumers with money, or all healthcare consumers. That means more for the poor, more for the sick, less for the wealthy, and a system where the nucleus of it is the healthcare, the patient, not some distant, unaccountable government.
Okay, so...
Hello, this is Carly Fiorina, and today I'd like to speak to you as one of the more than 2.5 million women in America who have been diagnosed with breast cancer and beaten it. Like everyone else who's diagnosed with cancer, I never thought it would happen to me. I was fit, healthy, and active. I even got regular checkups. But earlier this year, just 2 weeks after a clear mammogram, I discovered a lump through a self-exam. Soon after that came the diagnosis, the surgery, the long and difficult treatment regimen, and the painful experience of wondering whether I would make it, whether I'd pull through. I'm fortunate to live near one of the greatest cancer centers in the world. I'm fortunate to have the incredible love and support of family and friends. And my diagnosis gave me time to think about my future. Because one of the things that happens when you have to face your fears, including the fear of dying, is that you can face your future with renewed hope and enthusiasm. My doctors tell me I have won my battle with cancer. And I realize that this makes me one of the lucky ones. Last year alone, more than 40,000 Americans died from breast cancer. Aside from lung cancer, breast cancer is the most fatal form of cancer for American women. Nearly 200,000 new cases were reported last year alone. That's why a recent recommendation on mammograms by the U.S. Preventive Services Task Force a government-run panel of healthcare professionals that makes recommendations on prevention, struck such a nerve. The task force did not include an oncologist or a radiologist. In other words, cancer experts did not develop this recommendation. They said that most women under 50 don't need regular mammograms, and that women over 50 should only get them every other year. And yet we all know that the chances of surviving cancer are greater the earlier it's detected. If I had followed this new recommendation and waited another 2 years, I'm not sure I'd be alive today. What's more, this task force was explicitly asked to focus on costs, not just prevention. As it turned out, costs were a significant factor in this recommendation. Will a bureaucrat determine that my life isn't worth saving? All this takes on even greater urgency in the midst of the ongoing healthcare debate in Washington. We wonder if we are heading down a path where the federal government will at first suggest and then mandate new standards for prevention and treatment. Do we really want government bureaucrats, rather than doctors, dictating how we prevent and treat something like breast cancer? The response we've gotten to these questions has been less than encouraging. In the face of a national outcry over the recent task force recommendations, the Secretary of Health and Human Services said the Preventive Services Task Force doesn't set federal policy. The real question, though, is whether bodies like this would set policy under the $2.5 trillion, 2,074-page plan that's now making its way through Congress. Unfortunately, the answer to that question isn't encouraging either. The health care bill now being debated in the Senate explicitly empowers this very task force to influence future coverage and preventive care. Section 4105, for example, authorizes the Secretary of Health and Human Services to deny payment for prevention services the task force recommends against. Another section requires every health plan in America to cover task force recommended preventive services. In fact, there are more than a dozen examples in the bill where this task force is empowered to influence care. There is a reason American women with breast cancer have a higher survival rate than women in countries with government-run health care. Unlike those countries, our government doesn't dictate what prevention and treatments women can get. While some defend the idea of a government task force, my experience with cancer tells me it's wrong. Cutting down on mammograms might save the government some money that it will then spend on something else. But it won't save lives. And isn't that what healthcare reform was supposed to be all about? This is just one in many examples of serious problems with this healthcare reform legislation. Rather than remaking the entire national healthcare system at the cost of higher taxes and exploding deficits, we should build on what works, such as expanding access to integrated care and to community clinics that will give those most in need appropriate care at a reasonable price. Congress should reform medical malpractice to match what we have in California, where frivolous lawsuits are a thing of the past. We should permit consumers to purchase health insurance from any company in the country, expanding consumer choice and driving down cost and unnecessary mandates. People want to know that their care will stay where it belongs, in the hands of doctors and patients. Unfortunately, the path Congress is on in this debate is not giving us the confidence that it will.
We are right now looking at a law that will pay providers 80 cents on the dollar, then 66 cents on the dollar in this decade, going down to 33 cents on the dollar. So you're saying that we will be able to sort of mastermind how to pay for this care at those low rates, and they'll still provide these services. This is where I don't understand it. Ultimately, don't you believe that there's going to be a time where if you're going to so dramatically underpay for a service to a provider that they would provide to a beneficiary, that they'll just stop providing that service. I mean, isn't that effectively rationing in and of itself? If you don't pay the providers anything close to what it costs to provide the service, won't they just stop providing the service?
So the only concrete entitlement reform idea I got from him today was, yes, Medicare spending is unsustainable and it's got to be addressed. So he agrees with us on that. And then he wants to have this unelected bureaucracy just do price controls. That's the only idea we've gotten from him, and that's it. And we got to there's a lot more you have to do than that, which I don't agree with that, to fix this mess and prevent a debt crisis from hitting this country.